you ever been to the doctor, waited patiently for your turn, told the doctor your troubles, and then walked out totally unsatisfied, thinking that doctor just did not listen to a word that I said? If so, you're not alone. Our next guest says doctors are actually moving away from thoughtful engagement with patients, reducing you from a person with a story to just a list of top symptoms and a problem in need of a recipe of generic treatment. According to her, it's driving the cost of healthcare in this country through the roof, and worse, it's leading to the wrong diagnoses. All that from a Harvard-trained doctor herself. Joining us now is Leana Wen, MD, emergency physician at Brigham and Women's and Massachusetts General, and a clinical fellow at Harvard Medical School. She's also the co-author of the new book, When Doctors Don't Listen, How to Avoid Misdiagnoses and Unnecessary Tests. Doctor, thank you so much for joining us. And it occurred to me in reading this about how we need to tell the doctors more about ourselves, the doctors need to listen more to our stories. It actually occurred to me that there's a movement sort of away from that in standardizing care and having checklists for doctors to go through to make sure that no matter where you go in the country, you're getting a similar sort of care. Does that run counter to what you're saying in this book?
No, I think there are two different things we're talking about here. One is standardization for treatment. And I think that's good. I mean, if you're a patient and you're undergoing surgery, you want to make sure that a sponge isn't left in your body. I mean, that kind of checklist I'm all in favor of. What I am talking about is standardization for diagnosis, which is not a good idea because you want to make sure that you get your own diagnosis, not just the same pathway that every single patient follows.
Yeah, well, Doctor, along those lines, I had an interesting experience this summer. I guess I'm sort of conditioned looking for doctors to look for somebody with lots of experience, just under the assumption that they've seen everything and they'll have the best sense of what to do. I had a problem, and I ended up seeing a doctor with probably 30 or 40 years of experience, and I got the distinct impression that this doctor just had sort of a quick checklist of 3 or 4 possible diagnoses and listened to a couple things that I said, cut me off, didn't really pay attention, came up with the one that fit the closest, didn't really feel right to me, didn't fix the problem at all. I ended up going to a much younger doctor then for a second opinion, somebody who was basically just out of medical school, just doing residency and everything, and found that doctor was very interested in spending time listening to me, asking me questions, following up, making phone calls to follow up afterwards. And to the level of experience wasn't there, but I felt a lot more comfortable and confident in that younger doctor. Do you think that might be a wise thing to look for if you're a patient, a younger doctor who might just listen more?
I'm not sure if it's about age as much as it's about trust. I mean, your experience really underscores the importance of having a good relationship with your doctor, right? Finding someone who will spend that extra time to talk to you. And it's not a lot of extra time, but we actually know from studies that the average time to interruption when you begin talking to your doctor is something like 8 seconds. I mean, that's incredible, right? 8 seconds, and that's all the time that you have to really tell your story.
Sounds like being on the cycle.
Dr. Wen, I see telling your story is your number one tip. I'm grateful because my biggest fear when I go into my doctor is that I'm going to leave something out and he's going to miss something. So probably to a fault, unfortunately for my doctors, anytime there's something wrong, I go in and I download on anything that I think is relevant, from the discectomy I had 7 years ago to my recent bout with hiccups to, the bruise I just got the other day. I mean, is there such a thing as oversharing in terms of, clouding the process and making it even more difficult for my doctor to figure out what's wrong with me?
You bring up an excellent point, actually, because I do see that our patients who think that they're empowered patients, that they'll bring in all these printouts from WebMD, they'll Google their own symptoms.
Yeah,
and I think that's good. I mean, it's good to be educated and to know about what's going on, but you also do face the risk of having too much, this overload, right? And so that's why it's important to practice your pitch. Just like if you have 10 seconds to talk to your senator or your boss, I mean, you would want to make sure that you really practice that pitch. And so that's why it's so important to write down the key aspects of your story and to rehearse it in advance.
Lots of pressure here.
My sister is an ER doctor, and she told me that history taking is an art form and has to be done in a very proper way. So how can doctors get better at it? I mean, we have these patients who come in with their WebMD stuff. We have patients who want to talk to you for an hour. And a lot of doctors are egotistical. That's my sister's word. They don't have that much time. So is it on the doctor really to like get better at this art form, or is it on patients to really learn how to tell their story?
Ideally, the doctor should get better. I mean, we all want better doctors, and I think that as an educator myself, I want to make sure that the new breed of medical students, as what you guys were saying before, that the new breed will be even better than the older generation in terms of paying attention to the story. But in the meantime, there's something that the patient can do to help the doctor help you. And that's what I emphasize when doctors don't listen, that yes, the medical system needs to improve and healthcare reform is happening and doctors should take charge themselves. But in the meantime, that there's something very tangible that patients can do to get better care.
All right, Dr. Wen, thank you so much.
Thank you for having me.
And coming up, before Afghanistan and